First I'm going to show you the deep interrupted suture, and then we'll do a subcuticular. Again, I loaded the needle holder in the same way as we described. This time the stitch is not going to be on the outside of the skin. You're going to do the same motion. You're going to evert the skin, but this time instead of going from outside to inside, I'm going to stay with inside the wound, going from deep to superficial into the dermis. Again, rotating my wrist and following, grasping the needle, grabbing it as in a pronated position, and rotating. It's very important to follow the curve of the needle as you remove the suture. On this side, evert the skin, turn the hand back, pronate it, enter perpendicularly at the same depth as you did on the other side. Come through the skin, pull the needle through. And this point is very important to keep these two tails on one side, either this side or this side of this loop, so that this knot can bury itself. Meaning that when I tie this knot, as you'll see it's going to go down, it will not be protruding through the skin. And it will be allowed to be dissolved deep down within the tissues. I'm just shortening this suture a little bit for us. And it will not prick out of the skin, because if a little piece sticks out, it bothers patients, and it also has it's a nidus for infection from the outside, because this will be completely sealed. Again, we're going to go for an instrument tie between. When you're in the incision, I like to pull parallel to the incision, which isn't as important as outside. Between, grasp, pull. With monochrome, we really just put 3 or 4 knots in, even though it's a monofilament. It tends to give a little bit more, and it will dissolve, but you don't have to put as many knots in it. Again, you're going to want to pull it up together, the two ends. And this you want to cut very near the knot. As you can see, I didn't leave much of a tail like these, because I don't want it to prick out through the wound. You can see that that's buried nicely in there. And that's an important stitch for supporting the exterior stitches sometimes.